Now that healthcare reform has been signed into law, the question is being raised, will insurance companies raise premiums for those who are required to have health insurance? Eyewitness News reporter Leslie Miller is live in Woodland Hills with some people who are sounding the alarm. Leslie?
Michelle, a big concern for many tonight is what's not included in the legislation, and that's federal oversight for insurance companies who raise premiums by unreasonable amounts. Now at least one consumer watchdog group is pushing for regulation of insurers at the state level.
The new legislation will stop insurance companies from placing lifetime caps on how much they will spend on their members. It will stop them from unfairly canceling coverage. And in 2014, when the law requires all Americans to have health insurance, insurers will not be able to deny coverage to those with pre-existing conditions. But the president of Consumer Watchdog says healthcare reform doesn't go far enough to stop the insurance companies from overcharging.
There's no premium regulation in this bill. This is the missing link. And before 2014, when people will pay tax penalties if they don't buy or have proof of a health insurance policy, we will need premium regulation to make sure there are caps on how much health insurers can charge.
Today, the California State Assembly took the first step to regulate health insurance by requiring state approval if health insurers want to increase their premiums. That's the way it works now for auto and homeowner policies.
Rate hikes that are excessive, inadequate, or unfairly discriminated would be rejected.
The proposed pre-approval comes 1 month after lawmakers grilled Anthem Blue Cross, forcing company president Leslie Margolin to justify rate hikes of as much as 39% to 800,000 California customers.
Have you no shame?
The question is one that is disappointing to me, Mr. Chairman.
The insurance industry is opposed to the pre-approval process, claiming rate hikes are based on the cost of care.
A bill like this does absolutely nothing to lower the cost of health insurance, which is largely driven by hospital costs, doctor costs, and prescription drug costs.
Health insurance stocks went up after this legislation passed. There's a reason. The insurers now have a guaranteed market. By 2014, the U.S. government will be a collections agency.
The new legislation requires insurance companies to justify their premium increases, but they only have to do so on their website to explain it. There is no government authority that they have to answer to, and Consumer Watchdog says that needs to change. Reporting live in Woodland Hills tonight, Leslie Miller, ABC 7 Eyewitness News.